Hi, I'm Dr. Candace Good, a psychiatrist and PAMED member. Today I'd like to speak a bit about some of the characteristics that make us great physicians, how those are some of the same factors that can really be a setup for burnout, particularly because we are working in difficult times in a very imperfect system. I, like many of you, pride myself on being hardworking, detail-oriented, and helpful. But that also means that it's difficult for me to wind down at times. Sometimes I get lost in worrying about making a mistake or extra stress when things are particularly paperwork, virtual paperwork, charting, overwhelming. It can be difficult to set boundaries because I want to be available, but just because you signed up to be a physician doesn't mean you have to be everything to everybody all the time. I've been working with providers during the pandemic, process groups, check-ins. There's an amazing amount of frontline guilt, which was in some ways surprising to me initially because everyone was working so hard and continues to work so hard. But there's guilt around decisions that had to be made, care that wasn't able to be provided in the way that we wanted to provide it. And also some anger about care that we feel we shouldn't have to provide if people were following appropriate vaccination protocols, for example. The Medscape Physician Burnout and Suicide Questionnaire shows about a similar rate of burnout this year as previous years, 46%, although it doesn't speak to severity. There's also a shift to more emergency department physicians and critical care specialists. So just a reminder of today of all days that frontline guilt is survivor's guilt and is very common after traumatic experiences. And the symptoms can be misattributed to burnout. So if you're experiencing change in sleep, intrusive memories, irritability, numbness, feel like maladaptive coping, a lot of the things we usually use to cope and do to cope, we can't do. People are more socially isolated. Gyms were closed for a period of time. So if there's concern about self-medicating or increase in physical symptoms, I really would encourage you to take advantage of the resources that the foundation has on their website.